Hello everybody, so let's just discuss the blood supply of heart. And before starting the video, kindly subscribe to the channel because it motivates me to make more of such videos. So this picture over here is taken from USMLE Rx, and it's literally amazing. It explains everything, and the colorful theme they have used is very important to understand the blood supply of heart. Okay, I'm gonna start with the basic structure of heart. Okay, so this is your right atrium, this is your right ventricle. Actually, this is your right ventricle, this is your left atrium, this is your left ventricle, and then you have superior vena cava, inferior vena cava, aorta, pulmonary vasculature. Okay, so the blood supply of heart, the heart is supplied by your coronary vessels. Okay, your coronary vessels, remember this name. Okay, you have your aorta over here. Okay, and from your ascending aorta you have two major coronary arteries, your right coronary artery and your left coronary artery. Okay, focus this over here. This is your right coronary artery coming out of aorta, and then you have your left coronary artery coming out of aorta. Okay, I'm going to focus on right coronary artery first. Okay, and then we will be moving to left coronary artery. Okay, this over here is your right coronary artery. Okay, and then if I asked you what is the location of right coronary artery, very easy. The right coronary artery is running in a groove or sulcus between your right atrium and your right ventricle, right? Again, right coronary artery runs in right atrioventricular groove or sulcus. Remember this thing, okay? Right coronary artery. What is the area of supply of right coronary artery? Next question. Over here. This is supplied by your right coronary artery, your right atrium, whole of your right atrium, both anteriorly and posteriorly. By the way, this is your posterior view of heart. Okay, this is the posterior view of heart. So right atrium, both anteriorly and posteriorly, whole of it is supplied by your right coronary artery. Okay, now right coronary artery also supplies your right ventricle anteriorly. The major chunk of your right ventricle anteriorly is supplied by your right coronary artery directly. Okay, so yes. Now, right coronary artery gives a branch on the lateral surface of your right ventricle, which is known as your acute marginal artery. Over here, the acute marginal artery supplies the lateral surface of your right ventricle, both anteriorly and posteriorly, right over here. Okay, this artery over here supplies your lateral surface of right ventricle, both anteriorly and posteriorly. Okay, I hope this is clear. Okay, then the right coronary artery turns around and comes on the posterior surface of your heart, right here. It turns around and comes on the posterior surface of your right ventricle. Actually on the posterior surface of your heart, simply. Okay, not right ventricle. It comes on the posterior surface of your heart. Remember this thing. Okay, now important one fact about it. In most of the people, your posterior descending artery, right over here, actually I didn't tell you the name of it. Okay, so when the right coronary artery comes on the posterior surface of your heart, it gives a branch known as posterior descending artery. Remember this thing. Okay, okay, now in many people this posterior descending artery is derived from your right coronary artery, as shown in this picture. Okay, but in a few people, like for 10% of people, this posterior descending artery is derived from your left circumflex artery. I'm going to talk about this artery in a while, this over here. Okay, I hope this is clear. So the people in which your posterior descending artery is derived from right coronary artery are known as right cardiac dominant, and the people in which this posterior descending artery is derived from left circumflex artery, they are known as left cardiac dominant people. Very easy. Okay, so this was something you need to know. Okay, coming back to our topic. Okay, so this is your posterior surface of ventricles, right? I'm talking about both ventricles. Okay, this is the posterior surface of your both ventricles. Okay, if I divide this surface into three parts, Okay, if I divide this surface into three parts, the middle 2/3 is classically supplied by your posterior descending artery. Okay, right over here. Very important thing, this thing over here. So if I ask you the area supply of a posterior descending artery, you will tell me that posterior 2/3 of ventricular surface, both ventricles, okay, is supplied by your posterior descending artery. And then just beneath this posterior interventricular groove, you have your interventricular septum, right? If I just try to draw it, if this is your interventricular septum inside beneath this groove, this interventricular septum is supplied by two arteries. The posterior 1/3 of this septum is supplied by your posterior descending artery, okay, and then the anterior 2/3 is supplied by another artery, okay, which is actually left anterior descending artery. Okay, just for a while, just learn that this interventricular septum, the posterior 1/3 surface of this septum is supplied by your posterior descending artery. Okay, now location. What is the location of your posterior descending artery? Okay, the location is very easy. This is running in the groove between your two ventricles. I have another image as well. Okay, this is your left ventricle, and this is your right ventricle, and between the two ventricles you have a groove which is known as posterior interventricular groove, and in the posterior interventricular groove you have your posterior descending artery. Okay, remember this. Okay, so this was the right coronary artery. So a quick quiz. Okay, where is right coronary artery located? It is located in your right atrioventricular groove or sulcus. Okay, what is the area of supply of right coronary artery? Right coronary artery supplies your right atrium both anteriorly and posteriorly. Then it supplies the major chunk of your right ventricle anteriorly. Okay, important. Okay, now third, acute marginal artery supplies your lateral surface of heart, lateral surface of your right ventricle, actually, both anteriorly and posteriorly, both anteriorly and posteriorly. Okay, now tell me, where is your posterior descending artery located? It is located in your posterior interventricular groove or sulcus. And what is the area supply of your posterior descending artery? The posterior descending artery supplies your 2/3 of ventricles. Okay, 2/3 of posterior surface of your ventricles. Okay, it looks more good like this. Posterior 2/3 of your ventricular surface, both ventricles. Okay, and it also supplies your posterior 1/3 of interventricular septum. Okay, I hope this is clear. So let's just move towards your left coronary artery. Okay, now focus that from aorta, you have a left coronary artery over here. Okay, and left coronary artery gives a branch over here, this blue over here. Okay, this blue over here is your left anterior descending artery. What is the location of left anterior descending artery? Very easy. This is your right ventricle, this is your left ventricle, and between the two ventricles you have a groove known as anterior interventricular groove or sulcus. So your left anterior descending artery is present in your anterior interventricular groove. So now tell me, which artery is present in your posterior interventricular groove or sulcus? Obviously it's your posterior descending artery. Very easy and amazing. Okay, so let's talk about the area of supply of this left anterior descending artery. It supplies your anterior portion or anterior surface of your left ventricle. Anterior surface of your left ventricle. Okay, then during its course this artery turns around and comes on the posterior surface, and during its course it gives a branch known as left circumflex artery, and this left circumflex artery will be supplying your left atrium, both anteriorly and posteriorly. Because if you see this, this is your left circumflex artery, and it goes towards the left atrium, which is upward, okay, on the posterior surface. When it comes posteriorly, it goes upwards towards your left atrium and supplies it. Okay, now quickly answer. Which artery supplies your right atrium? Whole of right atrium, both anteriorly and posterior. It's right coronary artery directly. And which artery supplies your left atrium, both anteriorly and posteriorly? It's your left circumflex artery. Amazing, amazing, good job. Okay, then this artery, your left coronary artery, gives obtuse marginal artery over here. Okay, your obtuse marginal artery. See, your obtuse marginal artery supplies the lateral surface of your left ventricle, both anteriorly and posteriorly. Now answer me one question. Which artery supplies your lateral surface of right ventricle, both anteriorly and posteriorly? It's acute marginal artery. And which artery supplies the lateral surface of your left ventricle, both anteriorly and posteriorly? It's your obtuse marginal artery. Isn't it amazing? It's very easy and very amazing. Okay, so one important thing you need to know: where is your left circumflex artery located? This over here. Your left circumflex artery is located between the groove, in the groove between your left atrium and left ventricle. Okay, so left circumflex artery is classically located in atrioventricular groove on the left side. Okay, this is very important. You need to know about this. Okay, which artery is present in the anterior interventricular groove? It is your left anterior descending artery. Okay, so let's take a quick quiz. Okay, before taking the quiz, very important thing I just forgot to tell you. What is the area of supply of your left anterior descending artery? It's actually your important thing, your anterior surface of left ventricle, and just beneath this interventricular groove, you will have your interventricular septum, somewhat like this. Okay, so this interventricular septum, the anterior 2/3 of this interventricular septum is supplied by your left anterior descending artery. Okay, now tell me, which artery supplies the posterior 1/3 of your interventricular septum? Yes, it's your posterior descending artery. Amazing. Okay, just a moment. Okay, so now answer some of my questions. Which artery lies in your left atrioventricular groove? Yes, it's your left circumflex artery. Okay, what's the area of supply of left circumflex artery? Yeah, it's your left atrium, both anteriorly and posteriorly. Then which artery supplies your right atrium, both anteriorly and posteriorly? Yeah, it's your right coronary artery. Amazing. And where is right coronary artery located actually? Yes, it's located in your right atrioventricular groove. Amazing. Okay, which artery supplies the lateral surface of your right ventricle, both anteriorly and posteriorly? Yes, it's acute marginal artery. Amazing. And it is derived from your right coronary artery. Amazing. So what artery supplies your the lateral surface of your left ventricle, both anteriorly and posteriorly? Yes, it's your obtuse marginal artery. Amazing. And it's derived from your left coronary artery. Amazing. So in which groove your left anterior descending artery is present? In your anterior interventricular groove. Amazing. And then which artery is present in your posterior interventricular groove? Yes, it's your posterior descending artery. Amazing. Now tell me, which artery supplies the anterior 2/3 of your septum? if this is your interventricular septum, which artery supplies the entire 2/3 of your interventricular septum? Yes, it's your left anterior descending artery. And which artery supplies the posterior 1/3 of your interventricular septum? Yes, it's your posterior descending artery, right over here. Amazing. I hope you understood this video really well. If you have any kind of questions, kindly write them down in the comment section. I'll answer there. And kindly subscribe to the channel because it motivates me to make more of such videos. And have a great day and best of luck.